And we are live. Hi, good evening, everyone. Welcome to Level Up Live. I am Dr. Sharita Gaskins Tillett. I am your host, and I am so excited this evening. We have a very special guest, Dr. Delia, and we're going to give a few minutes for other folks to come in, but then we're going to jump right into it. If you are watching live, please say hello in the comments. Feel free to ask questions for Dr. Delia. And if you're watching the replay, hashtag replay, if you have questions, you ask your questions too, and I will forward them to Dr. Delia. So why don't we go ahead and get started? So Dr. Delia is actually going to introduce herself and tell us all about her. Good evening, Dr. Delia.
Good evening. Thank you so much for having me. I'm really excited to be here.
Thank you for coming. I'm excited to have you.
Okay, so I'll tell you a little bit about myself. I'm an integrative palliative medicine physician, and most people don't know what that means, and that's okay. So I started out as a family doctor way back when. And what I found in family medicine was that some of the patients that I had just didn't get better with the regular medicines that I had learned in medical school. And they maybe they had fatigue and headaches and chest pain, but it wasn't cardiac, and they couldn't sleep. And there wasn't really a pill for that. So through helping those people using some of the wellness tools that I used myself, I ended up in integrative medicine. So, seeing them as a whole person, how can we help them sleep? How can we help them be happier? How can we help them move? How can we help them feed their body well? All of a sudden, a lot of their symptoms got better. So that got me into the integrative medicine world. Okay. And then I merged into palliative medicine, which is the symptom-focused care of people with serious illness. So there's a big misconception that palliative medicine is end-of-life care, but that's wrong. It's not. It's just symptom-focused instead of cure-focused for people with serious illness. And then when I practiced palliative medicine, I realized that's wonderful, but a lot of the tools in palliative medicine are drugs and procedures. But what about these other integrative treatments like acupuncture and meditation and guided imagery and exercise and massage? They help symptoms too. So putting those two pieces together, the integrative and the palliative together, became my passion. And for a while, I ran a program, an integrative palliative medicine program, and it really works. It really, really works.
Can you tell us a little bit about some of the differences that you saw using integrative palliative medicine versus traditional?
Absolutely. So one of the wonderful things about palliative medicine in general is they understand kind of the mind-body connection, so that if you want to treat somebody's pain, you have to also treat their depression, you have to also treat their anxiety. So they understand that concept, but then the tools they had were drugs, antidepressants, anti-anxieties, medicines, etc., which are great. And I use a lot of medications, and that's wonderful. But there are all of these other tools for managing stress, for managing anxiety, for managing depression, like meditation and guided imagery. And if a person, for example, had pain and headache up here because they're stressed out by their life, yeah, I could give you a pain medicine, or we could talk about your stress. We could do massage to loosen up your shoulders and your neck. We could talk about your posture. We could talk about why are you so stressed out? And, maybe something's happening in your work life or your home life that's not making you happy. Let's turn the stress level down so that we're not just like, let me give you a drug.
Right. So it seems like less of a Band-Aid and more of a, you actually said that palliative medicine was more symptom related versus cure, but it actually sounds like it could be more cure.
Well,
in the final analysis. No, honestly, that if it does more, if you're giving people the tools that they need to be able to address the root cause of some of their symptoms, then that goes a lot farther than the pill that's going to be worn off in 12 hours.
100%. You're totally right. And the two parts to what you said that I think are so important. One is that it does get at what's underneath. So instead of just saying, yes, you have all this muscle tension, let's give you a pill so you don't perceive the pain. Let's get at the muscle itself, and then let's get at the psychological stuff that's causing that tension. So that's tremendously important is getting underneath what's underneath it all. But then the other part that's really important is teaching people tools and skills that they can do themselves. So if we teach someone how to recognize their own stress and anxiety and how to manage it themselves, or tools, non-pharmacologic tools that they can use for pain management that they can do at home, then when they get kind of wound up, maybe they don't end up in the ER. Maybe they say, okay, I'm going to use my toolkit that we talked about, and I'm going to exercise a little bit and take a shower and listen to my meditation app and, put the aromatherapy on and turn the news off. And by doing that, they may turn down their pain, turn down their mood challenges, turn down their anxiety, and then they don't have to end up in the ER. Gives a sense of control, which is really important.
Absolutely. Absolutely. So now, how does one go about obtaining one of these toolkits? And I'm being a little bit facetious because I know you don't have an actual toolkit, but
No, not yet.
tell us how you go about getting a toolkit.
So it's a great question. A big part of why I started the Integrative Palliative Institute. So I'm what I left out was I'm the CEO of the Integrative Palliative
So I'm going
Institute.
to interrupt you for 1 minute. Dr. Delia is extremely modest. So I'm sure all kinds of things about her are going to come out because she is a complete rock star.
You are too kind. You are way too
So
kind.
anyway, so yes, you are the CEO of what, ma'am? Tell us.
Of the Integrative Palliative Institute.
Okay.
And the reason that I started this is because I was practicing these two things put together, palliative medicine and integrative medicine, but I didn't know hardly anybody else who was doing that. And it just seems like this should be a thing. And I was talking about it, and a couple people that I know were talking about it, but not a lot of doctors are talking about it or doing it. And it's not rocket science. You can learn this. And I became passionate about, I want there to be 999 more of me so that patients, when they go to their doctor understands the importance of focusing on symptom management and the importance of using all the tools that work, medications for sure, but also evidence-supported non-pharmacologic tools. So I think the way to help patients ultimately is to teach doctors so that it just spreads and it just becomes normalized. And this is how we care for patients. So that's one arm of the Institute.
Okay.
And then the other arm of the Institute is support directly for families, because families who are struggling now maybe can't wait 5 years for all the doctors in the country to learn how to do this. They need help like yesterday. So for that population, I want to share some of these things that patients can learn themselves, family members can learn to help their loved ones, so that everybody can benefit from this concept of helping to decrease symptoms using all the tools that work, pharmacologic and non-pharmacologic.
Okay, wonderful. So how do you plan to go about educating all of the doctors
in the whole world?
Again, being facetious. How do you plan to go about educating all of the doctors?
So I've started educating doctors. I have a mentorship program that has a very significant didactic component that's evidence supported, because I'm going to back up for a second. I think it's really important that we do evidence supported work. So I don't believe that just because something is not taught in medical school means it's great. There's some wackadoodle things that we maybe shouldn't be putting into our toolbox. But we should know what's the evidence, and we should know what works for what. So, people say, for example, well, does acupuncture work? Well, it's kind of a silly question. It's like saying, do drugs work? And the answer, of course, is, well, some drugs work for some things, but not for other things. It depends. Same thing for acupuncture and massage and mind body tools, et cetera, is what do they work for? And what should I use it for with my patients? So there's a very significant recorded didactic component of really practical, evidence-supported, how do I put this into my practice right now, tomorrow? And then there's a component that is weekly meetings with me and the other physician group, because it's hard to learn this stuff in a vacuum. It's hard to just watch something and then go integrate it into your practice, because one of the things that I think is so exciting about helping people with symptoms is that it's kind of a puzzle. It's like a web all mushed together, right? Like if you break your leg, we know what's wrong with you. But if you're fatigued, You could
Right,
be
right.
fatigued from a million reasons, right? Like
Sure.
you're fatigued maybe because you can't sleep. Maybe you can't sleep because you're constipated and your stomach hurts. Maybe you're constipated because you're taking nausea medicines, but you're not taking constipation medicine. So like underneath that is, let's treat your constipation so you can sleep, so you can take your nausea medicine, and then so you're not fatigued, so you can live your life. So the kind of pulling apart of the complex patients we can do together as a group. And it also helps me to teach people really practical tools, like how to teach someone to meditate, how to use guided imagery in your practice, how to use tapping or EFT, emotional freedom technique, to help your patients manage their stress and anxiety and pain, etc. So it's very exciting for me to find heart-centered doctors who know there's a better way, not just about medicines, but are also evidence supported, and to have everybody learning together in a group. It's very exciting.
Absolutely. I love the way, again, that this kind of gets at the root cause of the symptoms rather than just treating the symptoms themselves. Now, I'm going to play devil's advocate a little bit
Sure.
because, as most of us know, we're under a time crunch when we're in the exam room.
Yep.
So how can we get to um, how can we get to the root cause in the time that's allotted?
Yeah, that's a great question. And that actually has been really on my mind as I practice these techniques myself and as I teach them. So I understand people don't have an hour with every patient. So part of how I teach it is in tiny little bites. So you can say, here's an example. You could say to someone, I think that your headaches are partly because your stress response is up. Here's a handout, which I provide. Here's a handout on the stress response. Anything that decreases the stress response, I think, is going to help decrease your headaches. Guided imagery is a thing that decreases the stress response. Here's an app. While I go take care of something else and you can go see the next patient, I want you to download this app on your phone. I'll be back in 5 minutes. Come back in. Did you download it? Great. Your instruction is to do that every night before you go to sleep for 10 minutes. Then when you come back in 4 weeks, we're going to talk about how that was. Right? So you did a whole counseling, probably 3 minutes.
Okay. Okay. So you may not necessarily, do an in-depth analysis in that one visit, but you can begin to get to what's
Well,
going on.
in terms of figuring out what's the underneath, actually, that's not that hard. And it
Okay.
doesn't take any longer than the history we already have to take. It's just a new way of approaching the patient, which I teach people to do. So that doesn't take any longer. And as a matter of fact, part of what I teach, which I think is really important, is office counseling tools. And the reason that that's so important is that can actually shorten the visit. So
Uh,
for example, if someone is telling you, story after story about, and then this happened to me and that happened to me and that happened to me, you could say, you know what, I'm going to stop you right there, because what I hear you saying is that your life is really stressful. And I think that that stress that you're having is worsening your headaches. So we're going to talk about ways to decrease your stress right now. And you may have saved 5 minutes of stories. Which you then can
right.
use to teach
Right.
them how to do
Right.
tools
Right.
when
Yeah.
they
Because
get
we,
home.
we've all been in those rooms.
Because what I found, before you know exactly how to handle that kind of like complex, stressed out patient, is there's a lot of emotion in the room, but you don't know what to do about it. And so you don't want to be a jerk, but you don't want to listen to it forever because you don't have
Sure.
time. But
Sure.
you have to have a sort of targeted plan. And once you know what to do with it, you can stop them talking when you've got all the information you need and go right into intervention.
Wonderful. Wonderful. So now, how long is this program? So you have a program that's for physicians, to train physicians to
I do.
do this. How long is that program?
So it's a great question. I initially did it in 5 weeks, but what I found was physicians are so busy that they can't do that much work that fast. So what I've decided to do is, it is now up to physicians to have me for a year so they can digest the information at whatever pace they want. They could get it done quickly and do all coming once a week to talk about cases, or they could take a year to get through it and not add any extra stress to their plate because everyone is so busy.
Yeah.
So it is going to be a year where they have access to me and the group to do cases, because the other thing that I saw is, it's not enough to learn it. You have to practice it. You have to bring
Sure.
this case, like, oh my gosh, I had this patient and I know what you said, but how am I supposed to handle this one? and then let us practice it together and make a treatment plan together. And then when you implement it a few times, then it becomes easy. So it is a year with didactics that can be consumed in a much faster amount of time if you want, or it could be spread out over a year.
That's excellent. So now I think that a really good place, and I'm sure you've already thought of this because I know you, would be medical schools. So are you talking to medical schools about this?
Yeah, so I teach in medical schools. I do teach I'm on faculty at the University of Maryland. I have taught medical students for a long time. That's actually where I started teaching medical learners about integrative medicine. Is for almost 10 years, I ran an integrative medicine elective for medical students. And one of the great questions that many people would ask me after this month-long course was, why is this integrative medicine? Shouldn't this just be medicine?
Yeah.
And I would say, yeah, yes, there should be no integrative medicine, because it's really just whole person care using all the tools that work. That should be this for everybody all the time. So I agree with you that getting into the medical school curriculum is crucial. The challenge, of course, is it's a very packed curriculum, and curriculum directors are very protective of their time. So if there are any medical students out there or curriculum directors who would like me to share, please let me know. I do speak often to really all levels of medical learners, medical students, residents, fellows, and attendings, because this integrative symptom management approach is of interest to a lot of different populations.
Right. Honestly, it should be of interest to everyone because it sounds like it could save healthcare dollars. It sounds like it could
For
save
sure.
physician time, and it
Yep.
sounds like it could get patients a superior outcome.
100%.
So, I
All
mean,
of those.
where is the lose in that?
Right. And it's cheap. This stuff is cheap.
Right, exactly. Healthcare dollars, save healthcare
Right.
dollars. So I want to transition a little bit because you did mention that. Well, there's a couple of things. I know that well, let's see, which way do I want to go? Let's go to the families first. You mentioned that you have another arm that is for the caregivers, for families of people who have serious illness. Tell us a little about that and what your approach is there.
Yeah. So that I'm creating, that will probably be done and ready maybe in another week or two. It occurred to me that family members kind of get left out. The patient has a lot of attention from the doctor. And hopefully when we train all these doctors in integrative symptom management, those doctors will be caring for the patients. But family members are left out and they are wiped out. Caring for somebody who is sick is exhausting.
Yes.
It's frustrating. It's sad. It's scary. And it's even sometimes deeply complex internally because people don't want to say it out loud, but often at a certain point they feel like, I don't want to do this anymore.
Yeah.
And now I feel guilty. I feel like a terrible person because I love my loved one, but I'm so tired. I'm depleted. And so all of these same symptom management for stress and anxiety and depressed thinking and pain and exhaustion, all of those same things are appropriate for family members too. And also, by the way, for physicians. Part of the physician course is using that stuff for the physicians themselves. Because for all of us, physician or family member, if we're depleted, we can't care as much. We just can't. Right?
Yeah.
When people get burned out, their empathy goes down.
Absolutely. Now, there's a question in the chat. I think I'd like to go ahead and read that now.
Sure.
So the person says, I'm curious. I feel as though this approach is exactly how I was trained in medical school, 1992 through 96. Any thoughts on when this changed? So the person says they have their own, but they're curious about what you think about when that changed.
That's interesting so you were trained in the integrative symptom management approach. I think that's fantastic. I would say in general, it's been getting better, not worse. So I think wherever you trained was kind of ahead of the curve. And when you look at the literature in complementary therapies, the non-pharmacologic kind of therapies, the literature has gone steadily up. And so as that literature has gone up and of better quality, where we have randomized controlled trials, medical schools have been more willing to accept it and teach it in some degree. So if you were learning that in the 90s, yay for you. I think that's fantastic. I don't think it's going down. I think it's going up, and maybe more medical schools will be as yours was.
Wonderful. So Now, as far as physicians themselves, and you mentioned that physicians, get burned out and have less empathy. But you and I were talking earlier, and I was telling you that as an OBGYN, a lot of times we have to deal with some pretty, when OB goes bad, it goes bad. And
Yeah.
so we deal with some pretty heavy stuff. And then, have to immediately transition to happy, happy, joy, joy. And there's you don't have anywhere to put all of that
Yeah.
trauma.
Yeah.
You just delivered a dead baby, and now you have to go in and be
Mhm.
excited in the next room. So what do you suggest for us?
Yeah, boy, what a great question. I do think OB has a bigger span than almost any of the rest of us. Um, and it doesn't probably happen that often, but when it happens, it's catastrophic.
Absolutely.
So I would say that the first big concept for OBs and then all the rest of us who have patients where things go terribly south, palliative care patients die all the time. Even in primary care, though, sometimes patients die. Sometimes patients die younger than is expected, sooner than is expected. The overarching thing is to not stuff it. And I think I was taught in medical school to stuff it. And so the first, it's not the only answer, but the first
Mhm.
answer is to have conversations just like this and say, we have feelings, we have this secondary traumatization when we see people suffer. It hurts us as humans, it hurts us. So the first step is just to acknowledge this was really tough. I was affected. I need to do something with this feeling. Now, the truth is, for physicians, you can't always do it in the moment because
Sure.
if you have somebody at 10 centimeters next door, you don't have time to go, like, I'll be back in an hour.
Right, right.
You need to do
Absolutely
what you
not.
need to do. But by the end of your shift or by the next time that you have space, if you have a lunchtime or have a little break, intentionally attending to that stuff is the first step. Now, there's two ways to think about it. One is what do you do in the moment, and then the other is what do you do as a team, as an office, as a group.
Yes.
In the moment, everybody has a different approach. So for some people, talking to somebody about it is really helpful. So some hospitals actually have kind of a setup section where you can call and say, I just had a really bad thing and I just need to unload to somebody. So some hospitals have an on-call system, peer-to-peer physician support. If your hospital has that, you should use it. So one of the mistakes that we make as physicians is we wait till we're like hanging on by our fingernails before we
Yeah.
ask for help. And we're like, no, I'm fine. I got it. Forget that. You're not fine. You just were traumatized by some really terrible thing. Go talk to someone. So if there is somebody, a peer-to-peer, go call them and unload. If there's not that, call someone that you care about or someone who cares about you or find a colleague in the hallway. I will tell you a story. I had a patient that really, I could still see his eyes. He was young, early 50s, dying, intubated in the ICU, but wide awake and wanted the tube out. And he knew he was going to die if he pulled out the tube. And his wife was at the bedside, but he was wide awake and he wrote what he wanted. And so we followed his wishes and we watched him. So he was alert and wide awake, and we watched him pass in front of us. And it was really difficult for me because I felt like had I not come to work that day, he would still be alive another day, which was probably
Mm,
true. Like he only died that day because we all made that decision, which was his wishes, but
sure.
still it felt hard.
Yes.
And I left that room and was just walking the hallways. So sometimes just walking, just like take a minute, go outside, walk around your hospital, walk up and down the stairs a few times before you go into the next room can help. I found then I didn't want to talk to anybody who was didn't get it. I
Yeah.
wanted to talk to another physician who would get it. And so I found someone who I wasn't even particularly close to, but I just said, I just had a really challenging experience with a patient. I just need to talk to another physician. Can I just talk to you for 5 minutes? And they said, yes, of course. And so I just unloaded. And basically the upshot, they were like, yeah, that's really hard. Because what
Yeah.
else can you
Yeah.
say? But
Right.
it helped a lot to just be seen by another person that this was an experience I just had and it was really hard. And for them to say, I see you. It was
Yeah.
really hard. Sorry you went through that. Just that is hugely important. Then when you get home, what are the self-care rituals that you have? Maybe a shower and crying. Maybe, some people sort of wipe the hard stuff
Yeah.
away. I sometimes shake. Like if I had a hard patients in my office would see me, or the staff would see me shaking. They're like, "Did you have a hard one, Dr. C?"
You gotta shake it off.
Take off the stuff.
Yeah, yeah,
Sometimes going for a run, sometimes writing in a journal, sometimes meditating or praying. What are the things that fill you back up when you get depleted? That's important.
yeah.
And then as an office, I think it's important, or as a hospital team, to have some kind of ritual with some sort of regularity. So when I was managing the integrative palliative team, once a month, we would have our mind body specialist lead us. She had a singing bowl, and she would say, "Give me the names." And so we would speak
Mm,
out loud to the group the names of the people who had died, or even some people who were really struggling that we thought might die soon and that we wanted to hold space for.
sure.
And then as she's playing the singing bowl, we would sit with our eyes closed and she would say their names out loud. And we would just make a little reverent space in this room for 5 minutes once a month. So
Yeah, yeah.
things like that are what I would
Right,
recommend.
right. No, I think, there's a term that I use. You guys may have heard me say this before, honoring your personhood.
Yes, exactly.
Because we do have this culture of self-neglect going in medicine. As an aside, I was actually talking with my personal trainer this morning about my lack of drinking water. And
Mm,
I told him, I said, you have to understand that I've been trained to ignore
yes.
everything my body wants to do.
Yep.
And so I have to now unlearn that and learn to listen to the cues.
Yeah.
And so similarly, we have to learn to take care of ourselves and understand that we are not superhuman,
Yeah.
that you have needs, we have feelings, and we need to process our feelings like everyone else. And then
Mm,
I think the other thing is to be sensitive to our colleagues. If your colleague has had, like, in OB, we generally practice in teams. If your colleague has had a bad day, then we maybe offer to take half of the shift, or offer to give them a little time and space to be able to process what's gone on.
yeah.
And one of the Facebook users has put in the physician coach support website in the chat, and that's
Great.
an excellent resource.
Thank you for that. That's a great resource. I think rituals in general are helpful to us as humans. It's why we have memorial services and funerals. It's part of how we cope with difficult things. And toughing it out and saying I don't need that is not good for us. It's just not, we don't have to do it that way. So
Right.
whatever the rituals are, and for your own self, for your family, for your office, for your team, I would encourage you to think about putting them in there, even if it's just like once a month check in with everybody. We're going to take 10 minutes at the start of some meeting just to check in. What's the fullness of your cup level? Are you depleted, in the middle, or full? How are you? Just rituals that acknowledge that we're human.
Yeah,
Like you
yeah,
said.
absolutely. So now you mentioned the course. You have an open, is the course open right now, or?
I would say 2 weeks. I'm just
Okay.
finishing recording and editing, and in a week or 2 weeks at the most, it will be available for
Okay.
family
And so
members.
if someone is interested in taking the course, how can they find you?
They can find me on my website, which is integrativepalliative.com. Integrativepalliative.com. And if you want to just email me from there, or even just sign up from there, certainly you will be informed about when the course is available. But you can email me directly from there and let me know, and I'll be happy to let you know when it's all ready to go. But it should be very soon,
Okay.
this month for sure.
Excellent. And so I always like to end on this one question. And guys, if you have questions that you want to put in the chat, feel free to do that now. But the one question I always like to end with, if you're talking to a physician who wants to up level their um, care of themselves as well as care of their patients,
Mhm.
what would you suggest the number one best thing they can do?
I would say to up level the care of their patients, they should go there, meaning don't be afraid of the hard conversations. If someone might be dying, say, I think you might be dying. If someone has something serious to talk about, we tend to talk around it. We say, well, I can treat it. But if what you mean is I can't cure it, but there is something we can do that might prolong your life, say that. Just go there and speak clearly to patients. It's easier for them. It's better for us. And it makes the interaction more pure and more human. So
Sure.
that's what I would say to up level that a lot of physicians don't do. We talk around stuff. Even in the ICU, someone is clearly declining and
Yeah.
a physician will come in and say, well, your potassium's better, right? Because we want to help so much.
Yeah.
We
Sure.
want to say something positive, but that actually wounds the family, because then when the person actually dies later that day, because that's clearly what was happening, they're wounded because they expected something else. So
Right.
just
They
go
thought it
there.
was turning around. Yeah.
Right.
Yeah.
For the patients, just go there. And for us, I would say do something to support yourself way before you think you need it. Just like we talked about before, we are so good at denying us and what is good for us, that of course you can take it. And do you need to talk about that difficult case? You don't need to. I know you'll be fine. Like, you could keep going, but don't do that. Don't do that.
Yeah.
Do on purpose. Let's pay attention to the fullness of our own cup. And if we ignore all our stuff until we're hanging on by our fingernails, then our cup gets depleted. And then everything's harder. It's harder to be a doctor. Administrators frustrate you more. Your
Yeah.
spouse is more annoying. Your kids are less well behaved in your mind.
Right. Right.
Because
Right.
when our cup is full, even hard things are easier. So
Yes.
that is the most important thing, I think, is on purpose, before it gets empty, fill up your cup a lot all the time with the things that feed you as a human being.
Right. And so I think that actually brings up a very good point regarding self-care, because a lot of times we kind of fit self-care into the corners of life. It's like, if I have some time left over, I'll get a massage. If I have some time left over, I'll do this. But we have to be very intentional about our self-care,
We do.
because that is the only way to keep our cups full. And we
Right.
want to be proactive about doing that, and proactive about having systems in place, it sounds like, because we're physicians. So we know at some point things are going to go in a way, because my husband's a pastor. And so
Oh.
he likes to say father time is undefeated. So
Yeah,
that
exactly.
ultimately we don't win the battle. And so we know that at times things are not going to necessarily go in a positive direction, and we need to be prepared for that in advance.
Absolutely. And the one thing I would say too, I'm so glad you brought that up, if you don't mind,
Sure,
is
no, go
that
ahead.
some people feel like, oh, palliative care must be depressing, or it's so depressing to talk to patients who might die. But you know what? We're all literally dying, everyone, 100% of us. But we don't focus on that. We don't spend most of our life thinking, oh my gosh, someday I'm going to die, so I can't enjoy today. And even if you're on hospice, you don't have to do that either, right? Like, we can focus on today and what makes us happy today, what fills up our cup today, because none of us know how long we have. You could be talking to that person with stage
Right,
4 cancer and you could go before them. We don't know,
right.
right? And so worrying about the end doesn't help us at all, but focusing on today and what fills us up today in the moment is really valuable and really, really important. And that, for me, that's a big part of supporting the well-being of physicians in this work. And I do, by the way, also, I have a podcast, the Integrative Palliative Podcast.
Yes. What did I tell you? She's gonna keep dripping. She drip, drip, drip. She's gonna drip all these things. I might as well drip a thing or two. She's also one of Baltimore Top Docs, recently named.
Thank
Let's see,
you.
what else can I drip about you?
That's good enough. But we talk a lot in the podcast about things to help us fill up our cup and focus in the moment, because when we think about, oh, that bad thing happened in the past, or, oh no, that thing might happen in the future, we empty our cup. And if you want to think of it like a gas tank, if your gas tank is empty, no matter how tough you think you are, you're not driving that car, right? So if we
Right.
let ourselves get empty, everything is harder. So focusing on, like, all the work that you do in this amazing live that you have, all the ways that we can fill up our cup, that's what makes the hard things not so hard.
Wow. Well, this has been a wonderful, wonderful discussion, and thank you so much for all that you do to help physicians to, handle heavy things, and for your work in helping patients to. What do you say in your bio, that you help palliative patients live their best life?
Yeah.
And those are not two phrases that you often hear together. that people with
Yeah.
serious illnesses are living their best life. But it is possible. And so thank
Yeah.
you for pointing that out to us as physicians. Thank you for pointing that out to families. And thank you for pointing that out to the patients themselves.
Thank you so much for having me and letting me engage in this conversation. This was so much fun. I really appreciate it. Thanks for all that you do.
Thank you. It's been my pleasure. And then, just my last little shameless plug. I want to invite you all to A Weekend for Me, which is our spring retreat, is happening in Cambridge, Maryland, March 24th through 26th. You can get information at www.aweekendforme.com. It is a retreat for professional women, so not just physicians. So you can invite your non physician friends to come along. And we're actually taking time away because we find that professional women spend so much time on everyone else, invest in everyone else, and don't take time for themselves. And so this is an opportunity for you to step away from your normal everyday life, but to not just step away and relax. There is relaxation, but it's also to take a good look at your life and figure out what's working, what's not working. I find that a lot of times when we're frustrated with our lives, it's because the way we're spending our time is not in alignment with our priorities. And so we will actually take some time to look at our priorities and how we spend our time and try to figure out a plan for getting those more in alignment so that we can live with more joy and more authenticity and live our best lives, enjoy this life that we've been gifted. So I would encourage you to check out the website. Please join us, www.aweekendforme.com. Again, thank you, Dr. Delia, and I will see you all next week. Take care.